Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the drugs used to treat tuberculosis. Tuberculosis is a global problem. It is an infectious disease caused by Mycobacterium tuberculosis, a non-motile rod-shaped, it is a bacilli, slow-growing acid-fast bacterium. It is transmitted through contagious patient's cough or by consuming unpasteurized dairy product from infected cattle. Many parts of the world, milk is not pasteurized. Okay, and the cattles, lot of the cattles are infected with tuberculosis. People may get bovine tuberculosis. Globally, 9.6 million new TB cases and 1.5 million TB-related deaths are estimated to occur every year. Tuberculosis treatment aim is very important. Its aim is to cure the patient of TB. Number 2, prevent death from active tuberculosis or its complications. Prevent relapses of tuberculosis. Decrease transmission of TB to others. TB may happen to any tissue. It is not only in the lung, it may be in the gastrointestinal system, maybe in the kidney system, maybe in the genital system, maybe even on the skin, eye, and also on the meninges of the brain. So TB may affect any organ. So these are the treatment aim to cure the patient, prevent the death from active TB or its complication, prevent relapses of TB, decrease transmission of TB to others. Anti-tuberculosis drug or anti-TB drug. We have first line of drug, second line of drug. First line of drug are the rifampin, INH, ethambutol, pyrazinamide, streptomycin. Okay, all of them are hepatotoxic and they can be taken by mouth orally. Streptomycin, mostly nephrotoxic or ototoxic because hearing loss or kidney damage, and this should always require intramuscular injection. Okay, and this is not in, it is an old drug, it is not in any of the regimens of the modern regimens, and it was for time being was not and is not produced in the United States, along with another drug, aminosalicylic acid. These two drugs may not be available in the United States due to non-production by the pharmaceutical industries. Okay, this is the second line of drug, aminosalicylic acid, also called PAS, para-aminosalicylic acid, capreomycin, cyclosidine, ethionamide, fluoroquinolones, macrolide, rifampicin, rifampicin. Okay, so these are the second line of drug. These are the first line of drug or conventional drug. They all may be taken orally, but this should be taken parenterally by intramuscular injection. And almost all of them causes hepatotoxicity. Treatment of tuberculosis. Okay, there are many regimens. Regimen depends on the country, depends on the patient's compliance, depends on the drug resistance. There are many strains with multiple drug or extensive drug resistance. Okay, and its prevalence is variable from country to country. Like in sub-Saharan Africa, India, Bangladesh has a lot of patients with tuberculosis, especially in the slum area, overcrowded area, and also in the refugee camp, a lot of tuberculosis. It is less in the United States. Okay. Treatment of tuberculosis, the disease may have to be treated for 6 months to 2 years. And drug regimen is also variable. Sometimes steroids may be added to manage some type of meningitis, TB meningitis or miliary tuberculosis. Resistant organisms readily emerge, particularly in patients who took the inadequate and irregular treatment protocol previously. This is a problem in many developing countries. The patient do not take the medication adequately and regularly. So the option is DOT, direct observation therapy. The patient should come to the hospital and in front of the health professional, they should take the medication in a routine way. That is the way to prevent resistance and the prolongation of the disease. All established drug regimens include multiple drugs like rifampicin, Isoniazid, Pyrazinamide, and Ethambutol. It should be treated by multiple drugs to prevent resistance. It should be treated for adequate duration of time to prevent resistance and to have cure. Monotherapy for TB should never be given. It will lead to the development of antibiotic, that means anti-tuberculosis drug resistance. In principle, it is important to follow the national and regional guideline for anti-tuberculosis drug regimen, specifically with respect to the World Health Organization. Okay, and CDC. Now we'll go to the CDC anti-TB regimen for 4 months. Previously, conventional standard therapy for 6 month or 9-month therapy. Now CDC has a lot of randomized controlled trial with the National TB Surveillance Agency NIH, and they found that 4-month therapy is equivalent to that of 6-month therapy. Even better patient's compliance and chance of less resistance. Okay, so now according to CDC, anti-TB regimen is for 4 months. First 8 weeks of daily treatment, rifampicin, Isoniazid, also called INH, that means isonicotinic acid hydrazide, pyrazinamide, moxifloxacin, this is a 3rd generation fluoroquinolone. Following 9 months, this is the first 9 months, then the second 9 months, following the first 8, following 9 weeks, this is the first 8 weeks, it should be followed by 9 weeks, the second half. First half is 8 weeks, daily treatment, second half is 9 weeks, daily treatment, with rifampicin, Isoniazid, and moxifloxacin. So the second 9 week, second half of the treatment does not include pyrazinamide. Okay, RPT, RPT means rifampicin, moxifloxacin is a treatment option for patients greater than or equal to 12 years with drugs susceptible to pulmonary tuberculosis. But you must remember that tuberculosis may happen in any organ, maybe in the epididymis, maybe in the fallopian tube, maybe in the eye, maybe in the skin, maybe on the meninges, kidney, in the gastrointestinal system. So in case of complicated cases, the TB regimen and medication should be managed by an expert individual on tuberculosis, expert physician or doctor. Licensed doctor should treat those complicated cases. Okay, so all the anti-TB drug has adverse effects, so patient monitoring is very important. Baseline monitoring, baseline liver tests are essential. Rifampicin and rifampicin. Rifampicin is an analog to rifampicin. Adverse effect is same as rifampicin. This and this. Hepatitis, hyperbilirubinemia, gastrointestinal upset, rash, flu-like syndrome, purpura, and will get interaction with other drugs. So person taking other drugs should be very careful, specifically women who are taking oral contraceptive pill. They should they should avoid all contraceptive pill because of this medication interaction. Their family may use the mechanical contraception. And also rifampin, the urine color will be pinkish, and tear and also other body fluid will be pinkish. Isoniazid, hepatic enzyme elevation, hepatitis, peripheral neuropathy. So we must supplement with vitamin B6, pyridoxine. Okay, so this better to, it is an indication. Isoniazid patient should take pyridoxine, B6. Okay, vitamin B6. Okay, vitamin B6 or pyridoxine to prevent peripheral neuropathy, because isoniazid prevent the absorption of vitamin B6. So the patient should get around 25 milligram to 30 milligram of vitamin C. There is the pyridoxine on daily basis. Pyridoxine. Okay, pyridoxine. Okay, we got that. So isoniazid has adverse effect: pyrazinamide, nausea, hepatitis, hyperuricemia, rash, joint ache, and sometimes gout. Because of hyperuricemia, we may have gout. Okay. Okay. So there will be hyperuricemia and gout. There may be pain in the joint, specifically the first metatarsophalangeal joint, ankle, and the knee joints. Moxifloxacin is a third generation fluoroquinolone. Adverse effects include diarrhea, nausea, headache, dizziness, nephrotoxicity, phototoxicity, and possible tendon rupture. The person's tendoachilles or the tendocalcaneus may be ruptured. There will be prolongation of the QT interval, so there may be arrhythmia. Okay, because of prolongation of QT interval. Ethambutol, optic neuritis, blurred vision, red, green, color blindness. So this patient should be monitored every month. And ethambutol should not be taken more than 2 months without doctor's supervision. In our old regimen, it was taken initial 2 months, then it is stopped. Okay, to prevent optic neuritis, even every month, the physician should look at the eye. Physician should assess the liver function. Okay, physician should look for the peripheral neuropathy. So there will be supplement of vitamin B6, that is the pyridoxine, around 25 milligram, along with isoniazid, this treatment therapy to prevent peripheral neuropathy. Okay, ethambutol may lead to optic neuritis, blurred vision, red, green, color blindness due to damage to the cones, particular cones, as a whole damage to the retina, streptomycin, ototoxicity, and nephrotoxicity. So their dose may be decreased to a person who is younger than 60 years. Okay, we got that. And that's all about the anti-TB drug therapy. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.